Dirty Laundry, Clean Confessions. Live, pre-recorded from the family laundry room with Smarge, Haas, and Not the Real Guest. Here, we are hanging it all out to dry. In the room, where famous people are loved, admired, and adored, however, not invited. With the exception of the great Willie Nelson, of course. We are keeping it real in the family laundry room with Not the Real Guest. Thank you for joining us today. How are you doing, Haas?
I'm doing well. How are you? It's laundry day.
It's laundry day.
A
Right,
good day.
right. Are you feeling caught up on your laundry now? Feeling behind? How was your last week?
Yeah, it's doing good. I like to do my laundry all in one day.
Mm-hmm.
You know, the cleaning, folding. I feel like most people drag that out for like a week on end.
Right.
But
Yeah,
I like
and then
to
it
get
just
it over
blurs
with
into
as soon as possible. So yeah, feeling good. Everything's nice and clean.
Is that how your
at home.
life's going too? Do you feel you're on top of it?
Nope,
Like you
not
want?
at
No,
all.
not at
Probably totally opposite. But how
But
about
hey,
you?
you're caught up on your laundry.
Yeah, right?
One
Little wins.
less thing to worry about. I'm
Yeah.
doing good too. I am
Yeah.
doing good. Do
How's-
you have any confessions or?
You know, I do have a confession, and I'm glad you asked this because I recently had to go visit the doctor, and
Everything's okay.
everything's great, just a
Great.
regular checkup, but my nurse was just amazing, and I'm realizing now that I just don't think I ever gave the proper credit to any of my nurses that I've ever interacted with. I think that they do so much for us, and I just think maybe they're overlooked a little bit.
Yeah, not as appreciated as.
Yeah.
And pat on the back to you, Haas, for identifying something like that.
Yeah.
Because it's usually, I had the worst nurse ever. And then we realize through the back door that, oh, maybe we should but you're like, I had somebody awesome and I don't think I've appreciated that.
Yeah, and I think really my confession is that I just don't even know what goes into the entire training that nurses have to go through, or, you know, all the everyday struggles that they deal with. I mean, it's a crazy profession if you think about it. I mean, nothing
Absolutely.
like what we have
and
to
I
deal
hear it
with.
takes a lot of schooling, a lot of time. So, well, please tell me, Haas, that you have Not the Real Guest in the nursing field.
We do. Guest today actually is Nurse Medina, and she's here to speak to us about her background and all the training she had to go through, and all of her challenges that she had to overcome during the pandemic, especially. And now she's actually a school nurse. So we'd love to hear more about that and what school she's at and those new challenges. So welcome, Nurse Medina.
Yes, welcome.
Hi,
and
guys.
school nurse. And thank you. Thank you
yes.
for all that you nurses do.
Yeah.
And especially a school nurse.
Yeah. Nursing is an interesting field. I mean,
Yeah.
You can do all kinds of things. So,
Yeah, so just to start, when did you even decide you wanted to become a nurse? Let's start from the very beginning.
I mean, I always knew I wanted to go into healthcare.
Yeah.
Since I was like 4 years old. At one point, I thought I wanted to be a doctor or a PA, a midwife at one point. And then I thought, let's start in nursing. So when I was in college, I was double majoring in Spanish and biology. And then the nursing program opened at MSU Denver. So I kind of veered paths and got my BSN and also my BA in Spanish. So,
Well, nice.
yeah.
Nice.
was it-
Hola.
Hola.
¿Cómo estás?
Bien, ¿y tú?
Bien. So
Um,
happy to see you.
Yeah, I did CNA work for like 4 years. Just to kind of get like my feet wet, get my foot in the door, kind of figure out if I liked this whole healthcare realm. And
Yeah. And what was that like? Was it really challenging?
well, so I knew right away as soon as I got into healthcare, I did not want to work in a hospital. A lot of people, you know, have that notion that, you know, if you're a doctor, a CNA, a nurse, that you must be working in the hospital. And I just knew right away, like, that was not for me. I had like plenty of clinical experience, and I did do like a 6-month stint as a nurse in the hospital. But as a CNA, I did home health care.
Mm-hmm.
So I did a little bit of residents who live like in these fancy buildings and they're independent living, but as their health gradually declines, you have to go in and kind of help them. So sometimes it is more severe things, you know, like changing diapers or emptying catheters. And sometimes it's, things that aren't so bad, like helping them get dressed or walking their dog. That was my favorite thing. We always got to walk their dog.
That sounds
fun.
really fun.
That's a great bonus.
Or do their laundry.
All right. Ding,
There we
ding,
go.
ding.
And, sometimes help them like clean up a little bit. And I had this one resident, I don't know, we were advised to go in and just kind of help them clean up their apartment. So I'm thinking, okay, like I'm going to go in and, maybe like organize the refrigerator, clean, like do some dusting, fold the laundry.
Right.
And I show up and the sweetest old lady, she's like, oh yeah, let me show you. And she drags me to this office room, to this closet, to this spare bedroom. I'm not kidding you. At least 2 or 3 rooms, floor to ceiling, cereal boxes.
No.
Cereal boxes. She's a cereal box hoarder.
She's a.
What?
There's a joke here somewhere. I know, like cereal. Oh,
Cereal
no, but
killer.
Cereal box
cereal
collector.
Yeah, in a
And
very
that's the
serial
thing.
way. Serious cereal.
Some
way.
of them were like very old boxes
Oh, you're
from
kidding.
the
Were they
70s.
empty?
So
Are these empty?
well, so I'm like,
cereal
okay, maybe she's like a collector, but some of them were like open and half eaten, and
What?
it was so bizarre. And
Were they
And-
full box? Like, were they to the tiny
no,
little
they were
ones?
like your very average size cereal box,
Right.
like Wheaties and everything.
I have a question.
Yeah.
So, this wasn't in her personal private residence.
No, it
This-
was because
Oh.
this place that I was working, it's like an independent living center. They're becoming really popular now for senior living.
Okay.
So they kind of have like, it's like its own little community. They have restaurants and like
But
movie
she
theaters.
was in this community.
She was in this community, but
Didn't
they have their
somebody see those amount of cereal boxes?
well,
coming
because
in?
she's independent. Oh, so when she moved in, they probably were like in boxes that,
Right.
you know,
I know.
and then her and
Oh,
her
so
husband
she even
moved.
Oh,
And then
she
her
had to have
husband
moved with these.
died.
Okay.
And
I
that's
just
when
had
her
to get
kids
the-
came in and were like, okay, she needs help cleaning this place up. And they obviously didn't want to deal with hundreds of boxes of
Right,
cereal. So
absolutely.
they were like, we'll hire these people.
Okay, that makes sense. At first, I was a little concerned about maybe
Mice? Yes, me too.
The place, no, the place where they were at, because I'm like, are these people not being monitored somehow? Because somebody's got to know 3 bedrooms worth of.
Well, so when you're in
But-
independent living, you're independent, right?
Yeah.
Like,
So they just have it come through when they moved in, come through the front
Yeah,
gate with
they
here's
must
our,
have.
here's our boxes.
They're
And literally,
independent.
here are our boxes.
They can do
Boxes and
whatever
boxes.
they want. You know what? They pay for that apartment. They can do whatever they
Okay,
want, as long as
okay.
it's not like they can't like smoke in the apartment, right? Because like
Right.
that could carry on to the rest of the facility. Or
Right.
So, like, my question is, I guarantee their children probably helped them box up their stuff in their house and then moved it all to this assisted living place. Like, right? I'm sure they did.
I don't think so, because when people choose to move into these places, they're not like on the decline yet. They know they're like going into retirement, but they're going into this community
Oh.
because, you know, they want like an easy retirement. Like there's going to be like a restaurant to go to every night.
And
there's
this
a
is
movie
on
theater.
their choice. They are cognizant
Yeah.
when they're moving in.
But they
and
start
getting
calling
ready.
health services in when they need a little
Okay.
more support because their health starts to decline. Or maybe they they had a recent injury and they just need to like get on the mend. So they need us to help come in and,
Mm-hmm.
like I had a resident who broke her hip and we had to come in and help her shower until she
Okay.
got better.
Okay, thank
but then
you.
once they
Yeah.
decline more, there is a separate facility where they can go
Right.
just right across the street, so they can get that's assisted living. So that's
And
where they
how
have
many
more
cereal
support.
boxes does that accommodate across the street?
I'm guessing that's when the red flags would go up
Okay,
and they would
okay.
say, I don't
Yeah,
think
I
this
don't
is
think so.
happening.
What did she want you to do with these cereal boxes?
Well, and that was an interesting part about my job too, is I would have increments of time. I had like a whole schedule. So like 30 minutes I would be with this resident, and then maybe like this resident would have me scheduled for an hour, and then this one over. So I only had 30 minutes. So there wasn't time for me to like sit there and ask, what's going on here, Gladys, with all this cereal?
And in retrospect, I'm
So-
thinking that wasn't really why you were there. You were there to help, not
Exactly.
To
I'm not here to, like,
diagnose, not to
judge or
judge.
criticize.
Right. Good for you.
So
Okay,
I just
you-
went in and helped her organize her cereal boxes. And
How did she want to organize them that day? Was it
By
alphabetical? Was it color?
Oh my God.
I'm not making fun, because I'm thinking that collection is making her, especially after the loss of her husband. You said her husband passed. It's probably filling some pretty big
Right.
voids she's experiencing right now. Because
Yeah.
obviously this is a collection that's taken her a long time to do, and she didn't
Yeah.
do it alone.
yeah. I mean, I think just what I learned is there's a lot of people hoarding things, especially from that generation.
Mm-hmm.
Yeah.
And, a lot of that does come from, as everyone knows, they were brought up in the Great Depression and resources
Right.
were spare. And so every little thing that they got their hands on, they kept. And
Right.
Well, Smarch has been accused of being a hoarder at times. And I must say that this woman doesn't sound like a hoarder.
No, not quite.
She sounds like a very avid collector.
Yep.
Maybe went a little awry.
Maybe
But
a
if
little
she's
crazy.
just
Yeah.
hoarding
Really.
one thing, how do you call that a hoarder? I don't know.
so maybe a
But-
cereal box collector. But I think what alarmed me was that a
They were
good
half
portion of them were like open and half empty. Like,
okay.
she like
Right.
wanted to try a little bit of every cereal. And I was like, but I can't simply part with it, even though it's
Right.
40
so that
years
is a hoarding
old.
sign. Right.
She
Okay. I
probably
see
did
that.
have some.
Yeah, that's
rodent
what kind
issues.
of exactly.
And that's
Right.
and you're a nurse. You've been trained like that. I have not. So that
And,
makes sense.
Yeah, I'm
That
going in
makes
with like a
sense.
health lens, right? Like
Right.
this is
Right,
not
yep.
sanitary.
Right,
Like you're
right.
going to attract rodents. Yeah.
Mm-hmm.
So on that note, I had another resident. Same thing. They wanted us to come in and kind of help him clean up his apartment a little bit. Very interesting man. I don't know if I dare say he was an alcoholic, but he did have me one day. He was like, "Oh, I just need you to go get like this box out of my car." And so I went down to the garage. I bring the box up, and it's a whole case full of Beefeaters gin.
Oh.
And I'm like, are you setting me up because like you're not supposed to have this? So like you're having me smuggling your gin?
was having a party.
Oh, okay.
Yeah, he was going to be sneaky about
which-
his
All the ladies
party.
over.
Yeah.
That's fine, except, when I go in there and I realize it was bad. Like his poor dog wasn't getting bathroom breaks. So like there was a whole room full of dog fecal matter. And then he told me to clean out his refrigerator. So I go to clean out his refrigerator, and I'm not even exaggerating. You couldn't even close the door because he had so many to-go containers from the restaurant at the facility with food that you couldn't even close the door. And I open it and they're all moldy, like caked
Oh,
in mold,
no.
like at least months old.
Oh no.
Disgusting. And so I'm like, okay, I'm going to throw it away. So I start throwing it in the trash, and he's like, no, that has to go down the sink.
What?
So I like start pouring some of it down the sink, and I'm like, this is kind of a health hazard. Like this is moldy. You want me to like run the garbage?
No.
No. So I threw it in the trash, and then he told me to put it on the floor so his dog can eat it. And I'm like, no, sir,
No.
like this is old moldy food. This is not healthy. And he got really angry at me and combative. So that's when you kind of notice people are on the decline, and you kind of have to report that. And
Yeah.
yeah,
Gosh.
so
That's so sad though. Yeah.
Wow.
but I will say for every like bad story I have like that, I have like really good stories too.
Oh, I'm
Oh,
sure.
nice.
Oh,
Well,
yeah.
let's share a good. What's like if you were to think, how long have you been in nursing now? How many years?
Well, if you include when I was a CNA, I guess
Absolutely.
a little bit over 10 years now.
Oh wow.
Yeah.
So,
Yeah.
what
Yeah.
would you say your like? If I was, do you have a top favorite memory that or couple that just kind of come to mind all the time about this is why I'm a nurse?
Well, when I was a CNA, definitely, because I was like working with the same people every day, which is what's really nice. You
very
get
rewarding.
to see, you get to see those people
Right.
and like kind of see how you're helping them every day.
Yeah.
I won't say names because, HIPAA is a thing,
Mm-hmm.
but I did have this resident. She was Jewish, and her husband were the cutest couple, and she would have us come and do services for her every 3 hours or every day for 3 hours at a time.
Oh, I was like every 3 hours. Oh my gosh.
No, I think she probably did have like some morning services. Like
Oh,
it
wow.
might have
I'm like,
very well
heck,
been every
sign
3
me
hours,
up.
but I always worked the evenings. I mean, I don't have like anything really like that, like, I don't know, like anything that significant about her. Just she really like touched my heart, and I think because she didn't like a lot of people, so she only had like a select few out of the 20-some CNAs. There's only like 3 she would let in her apartment, and I was one of them.
Ooh,
So I don't know. I
that
think we
feels
just,
good.
I think we just like kind of bonded, and
Yeah.
I kind of understood her, and she taught me how to like fold pants. Apparently, I did fold pants correctly, like or hang them on the hanger correctly. On the topic of laundry,
That's
it's a
how
thing.
I was taught. Seam to seam.
And she taught me how to do that, and to this day, that's how I fold or hang pants. And even my husband, he's like, "Why do you do it that way?" And I'm like,
Seam to seam to where it kind of leaves
Because
the
my
crease
resident.
down the center. It'll leave a
it,
crease.
Oh,
preserves the
yeah.
crease.
Yeah.
Yeah.
Yeah, I need
like,
to
dress
do
pants.
that. Yeah, because
Yeah.
my dress pants don't have a seam anymore. And I'm
No.
like, why is this wrong?
Well, you gotta hang them by the seam.
Seam.
Things you learn from old people.
I was thinking like jeans or something. I'm like, why would you
No.
do that? But
No,
that
but
makes
she was
sense.
very particular about her shoes. They all had to stay in plastic bags.
Interesting.
even though she'd probably wear them the next day. No
Right.
dust on those shoes.
Wow.
Well, speaking of about seams and jeans, Matthew McConaughey talks about a time where he feels like he made it big and he asked for middle seam creases down his jeans, and then he turned around and realized, like, what the heck? Who am I? Like, what am I doing? Really demanding creases in blue jeans, which I can see that. But dress pants, you want to keep those
Dress
seams.
pants, yeah, that makes sense.
Yeah.
But
So-
jeans,
But back to
I mean, yeah, I learned things from her. I had this one resident who literally just wanted me to come and watch TV with her for an hour.
oh,
Easiest gig, I'm telling you. Like, as a CNA, I'm downplaying this job because there are CNAs in hospitals who are doing, emptying catheters, changing diapers, like left and right. And I did do a little bit of that.
right,
But the vast majority of my CNA job was like, it's like the best CNA job you can have.
yeah,
And for people who don't know, CNA stands for Certified Nursing Assistant. So you
Okay,
work under a nurse. You're delegated under a nurse.
thank you.
Um,
Right.
Yeah.
Our listeners will appreciate that.
But yeah, I would just sit there and watch TV with her for an hour every night. And she always insisted on watching Fox News.
Oh, dear. I was going to ask what was on the
Yeah. And so I would always try to convince her, like,
Is that a bumpy cycle?
yeah, very bumpy cycle. But I would always encourage, like, oh, let's change it. And like Golden Girls, she loved Golden Girls. I'm like,
Oh,
who
good.
I love Golden Girls.
Who doesn't?
But every once in a while,
That is
you know
why.
Blanche from Golden Girls, she's a little risque. Every time like one of those scenes would come on, she'd be like, "Oh dear, oh my!" I'm like, "You said you liked Golden Girls." Like, okay, well,
yeah,
but
too much.
Oh, adorable. Adorable.
That's so cute.
yeah, I got to
That
walk
would
a
be
lot of
really
doggies,
rewarding.
and yeah, it was very rewarding. It was
Yeah.
probably one of the most rewarding like nursing tasks I did, even though I wasn't a nurse yet.
Yeah. Oh, I bet.
Yeah,
That's a good place to learn too. I feel like
it
because,
was.
I mean, you have to learn quick, honestly.
Yeah.
With
Yeah,
that,
and
with
then
that
making
crowd.
a difference, especially with someone that seems to appreciate it, that you kind of click with, and
Yeah.
you can help out. And
Yeah, and then like the most exhausting is like the dementia memory care.
Oof. Yeah.
I did really enjoy it, but it would always be like a 12-hour shift where you're just kind of monitoring these. We call them residents because it's their place of living. They're not
okay.
like patients. They're not in a hospital, but
Oh, okay.
but yeah, it was just it's so hard, and I can't imagine being like a family member of someone who has dementia because they don't know you, and 1 second they are in the present, like, yep, we're eating our waffles. And then the next second they're in 1973 and they're
Right.
taking their daughter to school. And
sometimes you have no idea when that trigger is, and they just
and then they realize, oh my God, like I'm kind of out of my mind. And then they get emotional and scared and
Yeah.
frightened. And it's hard.
Yeah.
Yeah.
That's really
but-
hard.
Yeah.
That would be tough. Tough.
Yeah.
But that's why we have great nurses like the one
Exactly.
before us.
What would we?
Thank you
what would we
again.
do without the nurses?
And then
for real.
back to that just real quick, you had said 12-hour shifts.
Yes.
Well, for one, that seems like a long shift to me no matter what.
Yes.
But do you think it'd be more beneficial for nurses, especially working with patients with dementia and Alzheimer's and that type of memory loss? Do you think there'd be less burnout for nurses if there wasn't these 12-hour shifts? Because I don't know how many times these residents can switch back and forth, and you have to get them back settled again and help them feel safe in their environment again. I could imagine through 12 hours that could happen. Like, how many times could that happen?
Yeah. Well, so I
Quite a
think
bit, right?
a lot of it. So back in the day, all hospitals right now, to my knowledge, are on like a 12-hour shift.
Okay.
So, you go in for work, you get a report from the nurse before you,
Mm-hmm.
and then, you do your shift, and then at the end of the shift, you give report to the nurse coming on. And so it is like part of it is consistency, for the patient and for the nurse. But yeah, 12 hours are brutal because 12 hours aren't really 12 hours. 12 hours are more like 14 hours because what you're doing is you're showing up to the hospital about 6:30, 6:45. And then your shift technically ends at 7. But if you didn't get your charting done, or if, things still need to be done, you still have to give a report. Sometimes you're not getting out of there till 8, 9 o'clock.
Right. Yeah.
And then, you're driving home.
Oh,
If you're on the
gosh.
night shift, that's pretty miserable. So, I mean,
Not only that, there's still only 24 hours in a day.
and exactly. So if you're doing like 3 back-to-back 12 shifts or three
That's what I was
12-hour
thinking.
shifts back to
Right.
back, I mean, everyone thinks, oh, that's so nice. You only work 3 days a week. Well, no, you're spending those first 2 days off sleeping.
Right.
Recovering.
Exactly. It's not
Yeah.
like a vacation. It's like recovery.
And when you're on night shifts too, you have to like completely shift your schedule, like your sleeping schedule.
Exactly. And Yeah, no, the sleep is just, it's terrible. And like,
Yeah.
you really don't get a break, especially like on those medical, we call them med surge, but medical surgical floors. Those are like ambiguous, all inclusive floors. They have people coming out from surgery, people we just like who are detoxing from alcohol. So all kinds of people, but those floors, all floors really, you don't really get like a set break. There's no set like lunch break.
Right.
You know, nurses
You
like
can't even have time to pee, I imagine.
you know, like nurses are like notorious for having UTIs because they don't have bathroom breaks. So
Oh my
they're just
God.
holding their bladder all day long.
That's crazy.
And yeah, and then they
And that's
end up
just
getting UTIs.
terrible because it's just like you're in the medical field.
Yeah, like you're
You know what
taking
you
care
have-
of people and this is how you're repaid.
You're taking care of people that haven't taken care of themselves sometimes, and now they're
Yeah.
there dehydrated or whatever. They have a UTI, but now you're being forced to give yourself a UTI.
Yeah, I mean, nursing is a very
That is
rewarding
tough.
career, but
Mhm.
it is very challenging.
I'm sure.
Especially in the hospitals. I am very fortunate. When I was in nursing school, I did something called a nurse externship. So I did 6 months in the hospital during nursing school where I could start doing some of my nursing practices, like
Oh, cool.
inserting a catheter or starting an IV. So, you know, just kind of like getting practice. But I knew right away, even in clinicals in nursing school, that the hospital was not for me. I always envisioned myself more like in outpatient care, like community health, that type of thing. And so that's what I went into. But yeah, hospital nursing is no joke. It's tough stuff. And
Yeah.
with the pandemic, I feel for those nurses because they got really burnt out and they were probably already on the verge of burnout. So
I wanted to ask about that too, about the pandemic and how that affected your career, because I know, well, it affected all of us, but it really had a big toll on obviously the nursing community and I mean the healthcare community as a whole. But how did that affect
Yeah.
your career?
So again, I wasn't in the hospital.
Right.
When I graduated nursing school, right away I started working in the allergy and asthma field.
Mhm.
I'm doing clinical work, which I absolutely loved. I still actually do it a little bit on the side. But so yeah, the nurses in the hospitals and really all the healthcare workers in the hospitals, you know, they had a really hard time.
Mhm.
Meanwhile, I'm in the clinic, and it's kind of a different lens because everyone's, you know, on like caution and don't go out and don't do anything. And so the worst place you want to go is a doctor's office, but
Right.
we still have to see people. So it was interesting learning how to rework everything. We figured out virtual visits really quick. Our clinic was not set up to do that, and they figured it out real quick because
Good.
we were losing a lot of money.
Right.
You know, I mean, something I learned day one, unfortunately, is healthcare is a business.
Right.
So even though, you know, we're trying to help people at the end of the day, there are, you know, big CEOs that are looking to collect a paycheck and make money and profit. And yeah, we weren't making any money in the clinic because people weren't coming in. So we figured out virtual visits.
Got to be able to pivot.
Exactly. But then when we were seeing patients, you know, one of the main things that we do in the asthma clinic is lung function test to diagnose asthma or see how well controlled somebody's asthma is. And that was shut down because it's not safe during a pandemic to be like breathing out a bunch of
Right.
who knows what. And,
Oh,
you know,
true. Yeah.
and then, so what a lot of people may not know is N95 masks. Those are, regardless of what healthcare setting you're in healthcare, it's a one-time use mask. So if you're going into a patient's room, you put on this one-time use mask, you go in and take care of the patient. And then when you come out of that room, you take off that mask and dispose of it. So the next time you go into that room, you'll have to put on a new mask.
Why is that? Like,
Oh.
how does something break down in it so quickly, or?
I think that's part of it, but I think also it's because now there like might be germs on that mask.
Right.
So you shouldn't be wearing that mask again
Anyway.
and spreading it.
Okay.
Now with the pandemic, what we learned, and even in my clinic, they gave me one N95 mask and they said, you're going to wear this. However, my clinic shifts were 9 to 10 hours long, but you're going to wear this, you know, for however, like 9 hours straight. And so in between patients, which is not protocol, that's not how you're supposed to use that mask, day after day for a year. I'm not even kidding you.
The same mask?
The same mask,
Not day. Like every day for.
the same exact mask for 1 year. They said we can swap
These are not washable masks.
They're not washable masks.
Okay.
They're disposable. They're meant for one-time use, not
Oh
one day
my
use,
God.
not 1 week use, Now they eventually changed that, but it was because there were supply chain issues
Right.
and everybody all of a
Everyone
sudden needed
wanted
all
one.
this PPE. personal protective equipment.
Right.
So, you know, going from learning you only wear this mask one time to you have to wear this mask for a year.
That's
you know,
insane.
it was very alarming. And I mean, I feel fortunate to work somewhere where they could supply us with that because there were nurses who were literally wearing trash bags for PPE. And now, you know, we know more about the pandemic and COVID-19 than we did, you know, when it first happened. So we know a little bit more about it, but nobody knew about it. We didn't know what to expect. So we were taking as severe precautions as we possibly could. At one point they were telling us to spray inviricide, which is like this really heavy duty chemical cleanser. They spray your mask with that at night.
Oh, and breathe it in.
And I was adamant. I was like, I'm not doing that.
Oh, dear.
No.
Oh, good.
No, I was like, I'm not doing that. Like, I would rather, you know, maybe get some sort of viral illness, even if it's then, you know, have long-term damage to my lungs.
Exactly, yeah.
And then they suggested, you know, alcohol, like rubbing alcohol. And even that, I was like, I'm good.
I thought you meant like, just have a beer after work. That'll make you feel better.
Okay, we're resorting to just take a drink and chill out. Okay.
Alcohol will make you feel better.
It's okay. Thank goodness that isn't what they meant, but okay.
Yeah, but so, I mean, for me in the clinic, it wasn't crazy. The worst part was, you know, just having to wear that same mask every day.
That's so gross.
I got really bad. I called it maskne. I want to say I coined the term, but I've heard it many times now, so I can't say I coined it. But, you know, just acne all over my chin because I'm wearing this really tight piece of cloth around my face all day.
Yeah. You have really nice skin, too. And the fact that it would even disrupt your skin that much is...
Yeah, and if you want to see Nurse Medina's skin, you can see a picture of her on her Instagram.
Yeah, check it out.
Yeah, but she's beautiful.
But yeah, I mean, wearing that mask all day was not fun. I would come home with just like these lines and red marks all over my face.
Yeah.
I have some like pictures and like some videos that I, you know, collected and documented just at the time. But yeah, it was kind of brutal, and it was just like, it hurts. You take off that mask and you're like, oh my God, my face. And that's another thing. You're already not drinking a lot of water during the day. When you have a mask on all day, it's not convenient to like, not with the N95s anyway. You know, some masks you can simply pull down, but the N95s, they're strapped to your head. Those
right. They're
babies
not
are on
coming
there
off.
pretty tight.
Yeah.
So, but so I feel fortunate that, you know, I was in the clinic. The worst thing, honestly, was because at one point we were kind of financially struggling. I don't know if I want to say financially struggling, but just, you know, being cautious because we weren't getting a lot of business. They cut our hours. So while all the other nurses in hospitals were getting overworked, people like myself, or even like people who were in like surgery, you know,
right, yeah, surgery would have been
like elective surgery, not like emergency surgery.
Right.
Those types of things, those departments were getting cut.
Yeah.
You know, so while half of the nurses were, you know, dying literally because they're in the ICU all day with these really sick people, the other half are unemployed.
Right.
I didn't get fully unemployed, but I did have, and I didn't even qualify for unemployment because I was still working enough, but like enough to like get cut some hours.
And like barely getting by, if that.
Yeah.
Right.
Oh
so that kind of sucked, but it didn't last long because, like I said, they figured out virtual visits pretty fast.
Good.
So, yeah.
Oh, that's so scary.
And now, a word from our sponsors, Hatcher Fly Co. They sell handcrafted flies for your river excursions. Steelhead, trout, salmon, and custom flies. Just recently dropped merchandise. Use the code Dirty Laundry for 20% off merch through May 15th. HatcherFlyCo.com. Fill the tug. Yeah.
And so now you're actually a school nurse, right?
Yeah, so now I am what we call a district RN. So I think every school district does it a little bit differently. There's kind of this like, you know, preconceived notion that like, you know, your nurse is in there all day in the school. And I feel bad because school nurses tend to get a bad rep.
Yeah, I know nothing about the structure, or I don't even know if one school has a school nurse or if a school nurse has three. And
tell me about your school nurse, huh?
Yeah, I do remember you giggling about a story. I would like to hear the story. I think our listeners would love to hear this story.
I mean, I don't know. I feel like when I was a kid, I just was constantly getting hurt. I don't know why. I just was very accident prone, and I just was always in the nurse's office. I think she just...
You're what we would call, Haas, a frequent flyer.
Okay.
FF.
Definitely an FF.
Frequent flyers.
Yes, I was definitely an FF. And I feel bad to this day because I couldn't even tell you what my school nurse's name was. I'll have to ask around. But I just remember the one time I went in there because she knew me very well. I went in there and I was probably way too old to be in there with this issue, but I walked in crying hysterically and she was like, "What's wrong? Oh, Haas, are you okay?" She used to call me Haas back in the day.
Oh, little Haas.
"Oh, baby Haas, are you okay?"
What's troubling you today, my son?
And
What
I
can I do to help
just
you?
crying and I could barely get it out. I said, "I put a bead in my nose and I can't get it out."
Oh man, so many questions.
So
Haas.
she helped me
Where
suck
did
it
you,
out.
where'd you get the bead?
She
Like,
sucked it out.
No, she like put a little like a suction cup on my nose and just
Wow, that's impressive.
I don't even know. But I just found it in the playground. I think I was like, this looks like it would fit in my nose.
I remember one of my children stuck a bead up their nose. And we couldn't get it out. Took her to the pediatrician. Pediatrician came in, had her try a couple tricks, like blowing it out, suction cup type thing. Didn't work. And I could tell that my kiddo just wasn't performing the way she could. So the doctor leaves, and I say, when we're alone, she's coming back with the longest set of tweezers you've ever seen. She's going to stick them up your nose.
Yep.
Unless you blow hard. And she just went, and then there goes the bead across the floor. Perfect timing. Right when the pediatrician opens the door, she even looks down. She sees the bead roll out, and she goes, "Well, my services are not needed anymore."
Oh, that's great.
But what is it, I wonder, about certain kids that think that's... Do you remember the thought, Haas?
With
No.
kids
Okay.
coming from, now a pediatric nurse perspective,
Yeah.
a lot of your world is through feeling and touching. And
Okay.
so, I don't know, like this bead, this is cool. What do I do with it? Oh, look, it fits up my nose.
It's like the
Oh, look, now
perfect
it's-
size.
Yeah. So, I
But
mean,
when
a
you're
lot
making bracelets with the beads,
it fits.
I mean, you're giving the beads a purpose.
If it fits, it
If
fits.
You
I
gotta
see what
see if
you
it
mean.
fits,
I
you
see
know?
what you mean. Your sensories and you're figuring it
Yeah,
all
it's just
out.
kind of like
and-
their sensory processing.
Right.
and-
So
yeah.
I'm sure you've seen some frequent flyers in your day. You have
I
any
have.
interesting tales?
So kind of to go back to Smarge's question about like how it works. Every
Oh, yeah.
school is a little bit different. I will tell you for the district I work, the high school nurses are in the schools at all times, but they still have a health aide. So we have health aides in all of our schools because a lot of what us district RNs do is like behind the scenes things. We're like writing care plans. We're constantly in meetings and really advocating for students like their health and making sure that there's not like a gap between their health care and their education, and just kind of bridging that gap. But yeah, I have seen some crazy things in the health room. Frequent flyers. A lot of what we see is kids just trying to avoid. We call them avoidance. And they're just avoiding, you'll notice they come in every day at the same time and it's like, oh, well, that's math class. Johnny's avoiding math class. Johnny doesn't like math. So you see a lot of that, but then also we're taking care of a lot of like severe healthcare needs. Like I have a lot of type 1 diabetics, which, is actually,
Oh, yeah.
it's intense care.
And they need insulin
They
injections
do.
still, right?
Well, it depends. There's
Okay.
actually a lot of new technology with diabetes, type 1 diabetes at least. There's pumps and there's things called CGMs which monitor their blood sugar, and I won't bore you with all the details, but there's all kinds of, interesting health conditions, and the nurse really is like an integral part in making sure that that student is, getting access to their health care, but still being able to learn. Field trips, like we got to make sure that they have access to everything they need on field trips. But yeah, I'll tell you about my first day as a school nurse.
Yeah.
We would
please do.
love to hear
So-
this.
Generally, like,
How many years are you in as a school nurse now?
I'm into my second year,
Okay.
so going into my third coming this
Nice.
summer.
Okay.
Okay.
Thank you.
Yeah, and I like it. I like it a lot. Can't complain having summers off. That is definitely a perk of the job.
Yeah, it's not bad.
Yeah,
Not
all those
bad.
holidays. But my first day as a school nurse, and I don't know if this is interesting to anyone, but generally like your days are fairly like low key. You get like your average like, I need an ice pack, I have a bloody nose, and that's generally what the poor health aide has to deal with all day long.
Beads and noses.
Beads and noses.
Classic.
Yeah.
I'm sure that happens all the time.
All the time.
So yeah, my first day, I'm trying to delegate new staff. I'm trying to like learn about my new school and get the ropes. And this little boy comes up.
Oh, and sorry, I mean, interrupt, but what are you at a high school, junior high, elementary? Like, what's your setting?
So yeah, because us district RNs are always, we're always behind the scenes doing a bunch of things. We have multiple schools.
Okay,
So that's why
thank
there's
you.
a health aide in every school, but then
Okay.
there's nurses and we have an assignment. My current assignment is one elementary school and one middle school.
Okay.
And I'll tell you, middle school is interesting because you still have like some of these kiddos who are still very much so elementary level. And then you have like the 8th graders who should have been in high school like 2 years ago because they're just that advanced. And so you're mixing these people together and it's an interesting mix.
Isn't that always been the problem with middle school?
Yeah, it's just middle school. But now
But it's very
worse
evident,
because
I
now
bet.
we have 6th grade in middle school.
Right.
Oh, that's right.
Yeah. But so yeah, my first day as a school nurse, I'm just trying to figure everything out, and it's already pretty chaotic. And then this little boy comes up, 4th or 5th grade, and he's like screaming at the top of his lungs, inconsolable. And he goes, my ear. And he claims that like a wasp flew into his ear. Now, this elementary school, they are very much so like in the wilderness. Like, we see plenty of wildlife. So it's very possible there was a wasp.
Okay.
But, so like I'm trying to do everything I can, like, try to blow your nose, try to see if it'll come out. Like, let's like, pour some water in there, like everything that we can possibly do. And I can't even see the object in his ear. So I do end up calling 911 because there's nothing I can do.
To console
There's nothing
him.
I can do. And well, at first I called his parents and the parents couldn't get there for over an hour. And I'm like, I don't think you understand. Like, he's screaming at the top of his lungs, like
He's in
inconsolable.
pain.
Oh,
Yeah, he's in pain.
no.
This is
Like,
real
there's
pain.
nothing I can do for him right now. So like, unless you can come get him right now, I do need to like have him transported.
Right.
So parents couldn't get there. So we do have 911 show up. They do decide to transport him.
Is he still in pain?
Well, he was in pain at that time.
I mean, when the paramedics got
So
there,
when the paramedics got there, they were able to treat him for the pain, and they were able to put something in his ear to kill the, I don't know what you want to call it. It was an insect. I'll get to that. But so at first the parents were like, please don't call 911. Like, don't do that. Because, if he gets transported, they're responsible for that transportation fee.
Yeah.
But I was like, look, like, if he needs to be transported, it's necessary. They're not transporting just because paramedics are bored. Like, he needs to go. So poor little guy went to one hospital and they couldn't get the object out. So he spent 8 hours basically going to 3 different hospitals. He went to Children's Hospital, he went to Swedish Hospital, and then finally a pediatric ENT over a course of 8 hours. He wasn't in pain the whole 8 hours because the paramedics came and right away, were able to relieve his pain and kill the insect. So it was, because every time the insect would move, he would like twitch in pain and like scream.
Fear. I mean, everything.
Oh, God.
But then when it was a horsefly. It was a giant horsefly the size of a quarter. They finally got it out of his ear.
No way.
Oh, poor little guy.
Yeah, so it's like no wonder he was like screaming and writhing in pain.
Oh, that's horrible.
And horseflies bite.
Exactly.
do.
And
So
they bite more.
bad.
They're not like a bumblebee that stings once.
no, multiple times. So that's why he kept like, he would like kind of like get a hold of himself, and then all of a sudden he would just like jump and like scream in pain because it probably was like stuck in his ear. And then if you think about it, his ear was getting swollen from all the bites.
Yep.
So then it got stuck in there, and then very painful.
Oh, poor
And the
kid.
fly's only going to be fighting for survival.
Yeah,
Right.
but so he spent an 8-hour day going from doctor to doctor till finally a pediatric ENT was able to extract the horsefly. And then the parents came back to me the next day and they expressed their gratitude and, thank you so
Good.
much. Like, that was the right thing to do. We just didn't realize the severity of the issue.
So that was your first day.
That was my first day.
Oh, my
And-
God.
And my mentor, as a new nurse in schools, you get a mentor that helps you guide because it's actually very complex. School nurse sounds like so like minimal and minuscule.
No,
but
it doesn't at
There is a
all.
lot to the job.
Yeah.
And she was like, "Are you gonna come back tomorrow?" And I was like, "Should I?" I did. And I'm
Do
glad.
you know something I don't know? Yeah, but still.
Well, and to this day, she loves to tell that story because it's not the status quo of your
And
first day.
No.
but just back to the school nurse alone, I can't imagine the responsibility for medication for that many children. To me, that just frightens
Well,
me.
so we always advise only bring in medication if it's absolutely necessary during the school day, right? Like if your child can take their morning dose at home, like do that because
In the afternoon.
yeah,
Leave
because
it
the
at
more
home.
medication we have, the more chance there is for error. And, the scary part, though, about being a school nurse, at least in my district, is we delegate that to other people, to other staff members, because we're not there every day, all day. You know what I mean?
True. You
Oh,
said,
So-
yeah,
good
because you're at
point.
seminars or you're working up the
Yeah,
plans.
I'm like
and-
in meetings, or I'm collaborating, or I'm at my other school. I can't always be at this school. So we have to really trust our health aides. And I'm so grateful for my health aides. They're amazing. They do a wonderful job.
Do you choose the health aides, or are health aides hired by the county?
Well, no, because we are very much so short-staffed, as we are everywhere right now. But we are very short-staffed with the schools in general. And so it's kind of, unfortunately, just take what you can get. So, yeah, I mean, there is definitely a staff shortage nationwide for everything, but definitely in schools, definitely in healthcare. And I will say with nursing, one of the biggest issues right now, especially in the hospitals, is travel nursing. Like, it's an amazing opportunity. And if you have the opportunity and that's something you're interested in, to be a travel nurse, definitely do it, because, it's 13-week assignments and you travel to these locations, and most of them will pay like your room and board, right? Like, they pay for a place to live, and then you get paid really well.
What is the idea behind it?
Well, the idea, so it's kind of, that's a really great question. We're all kind of puzzled by it as nurses, because hospitals can't seem to, like, hire people like full time to like stay on their staff. And a lot of the time it's because, like, when you do get hired on at a hospital, you're signing a 2-year contract, basically saying like, I will stay here for 2 years.
Okay.
Right.
Okay.
So what hospitals have turned to is travel nursing agencies, where they will get a nurse assigned for 13 weeks. And then, if the nurse decides they like it, they can stay. We had this actually a little bit in the school. We were having such a shortage after COVID, because COVID was so hard on the school nurses.
Oh, yeah.
I lived through it for a little bit, and it was, just calls all day long about COVID. It's miserable.
Yeah, and scary calls.
Yeah.
You have parents that are frightened and don't know anything. Yeah. I can imagine.
But so, what's going on in the hospitals right now, travel nursing, it can be a great gig because you can make really good money because the agencies pay you good money. But that means the hospitals are paying these agencies really, really good money.
Oh, I
So
see.
why aren't they paying their nurses who are loyal and working for their company under their brand that well? They're not. So it's like, I am happy for the travel nurses. Like, yes, like, get your bread. Like,
Seems like such a cool opportunity.
yeah, awesome opportunity. Like, if that were my cup of tea, I would totally be doing that. That's just not, where I'm at in my life. But
resort to such a difference of treating them with high pay to whereas you're
and that's
loyal
exactly the
nurses.
thing,
Yeah,
right?
what
Like,
is
why
that?
are you willing to pay and maybe it's because it's temporary, right? Like, we only have to, abide by this contract for 13 weeks, and maybe they're hoping it's like a short-term resolution before they get like some full-time staff that's locked in.
Okay.
But it's kind of becoming a long-term solution because nobody wants to work in the hospitals anymore, because it's, as we mentioned before, grueling and exhausting, and they're not getting paid very well.
Right.
I mean, nurses in general don't get paid very well. Teachers
Especially for
don't
what
get
you
paid well.
do.
Right. Yeah.
But so, I think that's a big part of the shortage too, is, people are like, well, why would I commit to working at this hospital for 2 years for,
Hardly anything.
$60,000 a year when I could be a travel nurse and make $90,000 a year?
Oh, I would.
It's a no-brainer.
Totally
I
do
can
And then
see
you can
that.
kind of, if you like to switch, and that's the beauty too, is if you like your location, sometimes you can sign on for another 13 weeks. Or if you're like, I don't really like Kansas, let me try California.
And then
So
you
you
get to
move
pick
on.
your location, do you think? Or
I think you get like a
sometimes?
select set of locations. Nursing can also be tricky because your license is only valid
I
in
was
certain
going to
states.
ask. Okay. So it is state mandated.
Yeah, Colorado has a thing called like compact state licensing. So your license is like honored in certain states.
Okay.
California is actually not a great example because they have very strict requirements. But if you wanted to get like a nursing license in California, all you have to do is like take a test and pay like, I don't know, I think it's like $500, and all of a sudden you have a California nursing license.
That's kind of cool.
Okay.
Yeah.
Okay.
But there are like, like Colorado, I think we have like at least 6 or maybe it's 12 states that we can travel to without having to adjust our licensure.
Well, I have a question.
Yes.
That doesn't, I think this could happen in any state in the United States right now with a school nurse. How is social media changing your daily
Great
visits
question.
from your students with
Yes.
what scares me is these TikTok challenges I hear about, right?
Yeah.
And I don't hear about them until they're on the news and they've made like headlines and it's all gone horribly bad, which, before you see that, there must be some crazy world going on.
Yeah.
And
Yeah.
I started thinking about these young kids and TikTok and all of that. Like, how does that work?
Well, Smarge, let me tell you about Tick-Tock challenges and the havoc that they are wreaking on our schools. And our
God
youth.
bless you. I can only imagine.
Yeah, I mean, we see TikTok challenges all the time. I don't see it in elementary school as much. It's more the middle school I see it. For a while, the big thing there was the one chip challenge. Have you heard of that?
No.
It's this giant one chip. It's like a $15, $20 chip. I don't know who's buying these chips for these kids, but it's super, super spicy. And it makes almost all of these kids throw up. So they eat this chip and then they come into the health
How
room.
big is this chip?
I mean, it's
She's showing the size of about.
like a giant tortilla chip, if you had to imagine.
Okay.
You know,
Okay. So
Okay.
not
I was
huge, but-
imagining like.
No, I mean,
Well,
if
you
you
have for
put
your money, and if you have to buy it
if
individually.
you put like your
but
fingers in like
Okay.
a triangle formation, I would say it's
a
about
giant
that big.
tortilla chip. Okay,
Okay,
that helps.
okay.
I actually never even seen the chip because they always eat the chip, but they bring the package to me.
Can
It's a big package.
underage? Do you have to be 18 or
I
anybody?
don't-
Because it's food. So I
I'm
don't know
thinking
what
they're
kind of
getting
law-
on Amazon, honestly, is my guess.
Okay.
You know, there's no regulation
Okay.
there. So, but yes, you know, they come to the health room, they're like, oh, my stomach really hurts. And then, you know, we do our little investigating and it's like, oh, you did the one chip challenge. And, you know, they almost always like, and part of that challenge, I think, too, is like drink something. I don't know the challenge, but I think it's like drink something fizzy. So then, like, of course, they
It's even worse.
induce their own vomit. And
Oh my god.
that's always fun. And in middle school, my health aide at my middle school, she's a rock star. So she's pretty good about saying, well, you did this to yourself. You have to go back to class. You know.
Good for her.
Yeah. No, I really appreciate her. Shout out to
Yeah.
her. But
And here's the second part of your challenge: make it through the rest of the school day without coming to your
Yeah.
school nurse.
It's a real
yes.
TikTok.
But let me tell you about the most appalling TikTok challenge I've seen. We had this kid come in one day and he's like, Miss, do you know what's wrong with my hands? And they were like really red and swollen. And we're like, well, I don't know. Do you know what's wrong with your hands? He's like, well, I did do this TikTok challenge where I sprayed Axe on my hands and then lit them on fire.
Oh my goodness! And for those that
God.
don't know, Axe is a body
Body
deodorant spray type.
Yeah,
thing.
it's
So
like a deodorant cologne spray.
So it
So
is
it's
a
flammable.
spray.
It's
It's flammable.
flammable.
Oh yeah, we used
Okay,
to do this
okay,
in
it's
middle school.
flammable.
When I was in middle school, we used to
So
do this.
But you didn't light your hands on fire.
So the
Oh,
challenge.
you lit your hands on fire?
we would light our whole bodies on fire.
Well,
We'd
this
light
is
our
news
hair
to
on
me.
fire. Yeah, remember we did? Okay.
Yeah. Well,
Haas, where did you go to school?
I
Dear
had-
Lord. Well, we need to have a second.
Okay,
on
but
My
that.
brothers. My brothers.
okay, the
Oh yeah, you
difference
have brothers. That's
Mhm.
true.
They tell me that.
the difference, Hans, between our generation and this new generation is we know better. Like, okay, if we tell the adults, we're gonna get in trouble for
Right.
this.
Oh, I would
As
never
long as
tell
it's not a
anybody.
medical emergency, let's keep it on the DL.
Mhm.
I had a student come to me with a new belly button piercing that she gave to herself,
Oh,
seventh grader.
no.
And she's like, yeah, I just need an ice pack. And then she's like, actually, I don't know if I can walk because like she was kind of trying to brag, like I have a new piercing. So what do? We call mom because that's what we're obligated to do
Right,
that.
right.
And then so same with the TikTok student, same with the belly button piercing student. Miss, why did you rat me out? Why did you rat me out to my parents? It's like I'm an adult. I'm obligated to
Yeah, we
keep
have
you
to.
safe.
So are his hands okay?
His hands are fine. I did
Okay.
call dad and I was just like, I really think you need to take him in. And it turns out his hands were fine, just very minimal burning.
Yeah.
But
So
Kids.
for those listeners,
dumb.
please don't try that particular TikTok challenge.
yeah, I would.
Good
I mean,
Lord.
that one's harmful. That one can end dangerously.
Yeah.
And he was in 7th, 8th grade?
Seventh grade. Wow. Seventh grader. Yeah.
Because
So
that could have
dumb.
gone extremely wrong for him.
Oh, it could have. Yeah.
I'm glad
Yeah.
it didn't.
Yeah.
Oh.
Burned down his house too.
Boy, so you feel a little bit like a family counselor too, don't you? I guess.
Oh,
like,
you do
oh,
all
my
of it.
Lord.
You gotta
Yeah.
talk them off the ledge.
you got to talk the
You gotta
parents off the ledge,
talk the pa-
probably.
I would say that's the hardest part about my
Oh,
job,
is it?
honestly, is the
Ooh,
parents.
yeah.
Okay.
Some of them are really delightful and wonderful, and some of them, I hate
Just
to say
ruin
but
it for the
they're
delightful parents.
They're a nightmare. I'm like, what? You need a hobby. Like, stop
Yeah.
calling me, bothering me
Chill
with
out.
nonsense. Yeah. But
Oh,
no, it's a
sure.
great job. It's rewarding. I
Yeah.
love it.
Well, thank you so much for sharing. I mean, and
Yeah.
thank you for your service.
Well, thank you for having me.
Yeah.
Well, and we look forward to having you back at some point. So
Yeah.
how are you feeling? I feel like, Haas, this was I think it was kind of a bedding, kind of slower
Mm-hmm.
to get the idea of what we're talking about, like the structure of what it is being a school
Yeah.
nurse and how that structures with the county, with the state, all
But it's
that.
real dirty, so you got to keep
and you,
it in
yeah,
there.
so I think, and you
Real
got to
long.
do it slow and walk through it. I think this is a bulky bedding
yeah.
cycle.
Second rinse too.
And I think it's come out great.
I mean, it looks wonderful. We're hanging out to dry right now. and
Absolutely. And we're
turned out
pleased. How are you pleased?
I'm pleased.
Is our not the real guest pleased?
I'm very pleased. Thank you for having me.
Hey, before we wrap up this spin cycle, Haas and I would like to give a quick shout out to those listeners who may be famous. We really do adore you, and even though you do not qualify as an NTRG, not the real guest, we would always love to hear from you. This is Smarge and Haas, keeping it sorted, keeping it real, from the family laundry room. Be safe, stay even, and remember, when in doubt, go half.
Thank you for listening to Dirty Laundry Clean Confessions. Follow us on Instagram at Dirty Laundry Clean Confessions. And if you would like to be the next Not the Real Guest, please email us at dirtylaundrycleanconfessions@gmail.com. We would love to air out the dirty laundry with you.